Good morning. Now we'll be talking about examination of a urinary case. What are the various pointers which will give you an estimation of the diagnosis, and what are the various historical and physical examination point which will give you an idea of the diagnosis. It may not be possible to describe the entire investigative armamentarium simply because the investigations will vary from case to case, and some general investigations will of course be there, but then by and large the investigation might be case specific. So therefore we will look at historical points and we will look at the physical examination. Now the first thing that with the moment the patient comes to you, and the general history that we always take with reference to their age, for example, might give you a pointer to the kind of pathology they may be suffering from. For example, a case of a small child coming to you with a renal mass likely to have a nephroblastoma. On the other hand, somebody who comes in the third and fourth decade may have a renal cell carcinoma. I'm giving you two examples. And somebody who's also presents in roughly about the same time can also harbor a polycystic kidney disease. Now, this boy here, for example, is a boy of 14, 15 years, and he can also have an early onset polycystic kidney disease. And if a woman comes to you, you should think in terms of pyelonephritis, specifically after marriage. Now, similarly, that applies to also the factors of sex. A male person is likely to have those pathologies which have a predilection for the men. For example, again, renal cell carcinoma and pyelonephritis bring back the same honeymoon cystitis and pyelonephritis post-marriage situation after the resumption of regular sexual intercourse. So these things have to be kept in mind when we take this history. Residence is also important. For example, if you have a patient coming from dry areas like Rajasthan or even Punjab, the possibility of calculus, renal calculus. And if somebody is coming from areas like Egypt, and you should think in terms of schistosomiasis. I know a large number of us in our country, we wouldn't have seen a case of schistosomiasis. But should you get a person from those regions, you should start thinking about them. What about the social status? It is believed that people who come from lower socioeconomic status have a tendency to form calculi. Is it because of diet? That is not absolutely certain, but the possibility of calculus happens to be more in lower socioeconomic status. And about the occupation. For example, if you work in occupations where water supply is not there, people are not able to drink enough water, or working in front of hot furnaces, they, like textile workers, printers, or even hairdressers for that matter, they tend to have a predilection towards carcinoma of the bladder. Aniline dyes are known to be one of the factors which produce carcinoma bladder. So occupation has also an important role. And if somebody, as I said, was coming from hot working environments which are very hot, they can even form calculi. So therefore, the various factors which look absolutely routine for us, they all have important pointers to what is the kind of disease that a person can be suffering from. Now let's look at the complaints. And one of the commonest complaints that we usually talk about with reference to urinary tract is the pain. And in order to localize the pain, we would sort of go through some factors of anatomy and to localize the characteristics of the pain, localize the site of the pain. I think to keep in mind some parts of the anatomy is very important. Here's a young boy who is lying down with almost unclothed excepting for the lowest part. And there are various anatomical points that I have marked here. This is his xiphisternum. This is his umbilicus, which is marked as L4 and roughly L4. Not that it is always at L4. Sometimes it can even be up to L5. Roughly, it is in the region of L4 and L5. And if you take the distance between these 2 points and bisect it, say approximately at this point, I have put 2 points here. If you draw a line here, then that is a transpyloric pain, this line. is a transpyloric plane. This is an important anatomical plane, and a lot of things happen here. But for the purpose of our discussion today, it is a hilum of the kidney we are looking at. That is approximately 4 centimeters away from the midline. This is the hilus of the kidney. So therefore, the point that I am wishing to make to you is the location of the kidney, and is the palpation of the kidney, and the ability to palpate will obviously depend upon where it lies, and you can very well see that a large amount of it lies well above the costal margin, in other words under the rib cage. The place where it is located will depend slightly different from the right and left side, because the mass of the liver is sitting here, that pushes the right kidney slightly down. On the other hand, the left kidney is slightly higher up. So we have to take that into account when we are examining the kidney. Now, supposing if you roughly draw a shape of the kidney, and let us assume that this is L4, and somewhere around here, lower border of L3 would be somewhere around here. It's not precise, it's somewhere around here. And so therefore, if you draw a line, keeping this to be the hilum, just let us draw a rough kidney. There, say this is the hilum, and if you draw it like this, somewhat like this. Let's draw it. If you draw it like this, then you can see this is the lowest part of the costal margin. So you are likely to feel only the lower pole of the kidney. Majority of the kidney is going to lie above this particular line. So this has to be kept in mind when we are examining. And this is one of the reasons why palpation of the kidney can be quite difficult. We'll talk about it as we go along as to how to palpate the kidney. Currently, we'll restrict ourselves to pain. So whenever we talk about pain, the points we ask for, when points we discuss, will be same, wherever the pain is coming from, whichever place in the body. First thing that we ask about is what the nature, onset of pain. Is it acute or has been there for a long time? That is called chronic onset, right? We'll first try and find out whether it's an acute or chronic. Then second is duration. How long does it stay? Is it something which comes and goes or not, or it stays continuously? The pains which come and go are typically the colics, which are very important in this part of the body, rather in this system. And always remember that colics will arise in hollow organs, unlikely to arise in any other manner. For example, it will arise in the ureter, and renal colic is somewhat of a misnomer, because if you have a stone in the renal pelvis, that will produce a colicky pain. But if you have a kidney which is arising purely from, if you have a pain which is arising purely from the kidney, then it is unlikely to be a colicky pain. So there has to be a hollow viscus in order to produce pain. So we can have renal pain, we can have a ureteric colic, and further down the ureteric colic can extend. If you draw a ureter, I'll draw the ureter here. If you draw a ureter, then in that case, along that line, the pain can come. So let us look at the different types of pain that we are going to have. First, as I said, pain of renal origin. It can be anterior or it can be posterior. We'll go to the posterior side just now. And it can be anterior or it can be posterior, and it can radiate to some extent. So now if we look at the back of the patient, so now this is the kidney that I have drawn from behind. There are surface markings here also. This is his T12, L1, 2, 3. Normally the kidney extends from L1 to L3, lower border of L3. And this is called what is called a Morris parallelogram. Now this is the hilus of the, I have slightly exaggerated the points in order to make it clear to you. This is his 12th rib, and this somewhere here would be the hilus of the kidney, should be the hilus of the kidney. That's about 3.5 to centimeters away from the midline, and this is about 8.5 centimeters, 5 centimeters being the width of the kidney. So if you draw roughly a kidney shape in this region, that is where the kidney is going to look. This is 12th, and just below this, see this hollow kind of space? This is the renal angle. This is the 12th rib. This is the renal angle, just below the 12th rib, and this is the margin of erector spinae. What you are seeing here, this is the erector spinae. So just in this area, this is the renal angle. So if you have pain which is arising from the kidney, or if you have fullness, if you have a swelling in the kidney, this angle is likely to be full. Right now it is, the boy hasn't have any pathology, so this angle is nice and hollow. But when it is enlarged, the kidney is enlarged, this angle is going to be full. I'm mentioning this along with the pain because I'm not going to come back to this area later on, and therefore I'm sharing those points also with you. So this is the renal angle, and this is the hollow, which is which will get filled up if there is a swelling of the kidney. And if you punch it in this area, the so-called Murphy's punch, then you will also elicit some tenderness, right? So please remember this area, this hollow here, and this is where the kidney swellings will show up. This is the Morris parallelogram. Roughly the location of the kidney is L1, 2, 3, lower border. So now have